So hello to all MDS aspirants and welcome you to Sail to MDS Dental Academy. So myself Dr. Malay Trivedi, I am pediatric dentist and assistant professor in College of Dental Sciences. So dear friend, as you all know that from tomorrow we are going to start with our Edge revision series for the NEET and AIIMS student. This series will extend from May to December. So this video is guideline regarding what all you should have before your preparation, and we'll discuss some few most important points. Already we uploaded few video regarding NEET MDS preparation, what all take care you have to do, what all things you should require, how you have to proceed, all the tips, how to prepare in 6 months. So many video we have uploaded. You can go in the description box and you can watch them. So now it is an orientation lecture. But dear friends, I never believe in orientation because you all are grown up. Now imagine that you have completed your +2 and you are coming for the BDS. At that time we need to orient you, but now you all are BDS, so it is a directional lecture. My role as an educator to you, as a teacher, I want to direct you in such a way that you can be in the top 300 of NEET exam. Fine. And I want all my aspirants, everybody who is watching the video, you should tell in a day at least 3 times that I want to be in top 300 of NEET MDS. Fine dear friends. Now before studying about the exam, you should know what that exam is. So the syllabus for the NEET MDS exam is whatever the subjects the syllabus they are taught during your BDS course, that is prescribed by DCI. Then how the exam will be there, it will be in the CBT form, that is based on computer network. You will have online exam. The exam will comprise of around 240 multiple questions. You will have 3 hours. For correct response you will get 4 marks. For incorrect response -1 mark will be deducted. And if you unattempt the question, 0 marks will go. Fine dear friends. So now what is the subject wise distribution of questions? So now many students are asking me, sir, which subject is more important? So you can see from the screen your all subjects are equally important, and this everything is from your NBE performer, your NBE guidelines. Okay dear friends, so you can see your first year subject, your second year subject, your third year subject, and your final year subject. So all have equal weightage of around 14 to 15 marks. So if at all you leave one subject also, then gone. Okay, you have to concentrate equally on each and every subject. Then the question pattern. So if you ask me before 3 to 4 years, there were just 2 questions they used to ask, that is single based answer and image based question. But from last 2 years, the question pattern of NEET and AIIMS exam have totally changed. I have prepared many such video regarding that, what is your NEET exam pattern, how you have to approach and everything. You can go there. Now in review I will tell that we have around 7 to 8 type of question pattern, that is single based answer, we have multiple answer question, we have image based question, case based scenario, true and false, extended matching question. It means you will have one theme, components, and you have to answer the questions based on that components and the match the following. So dear friend, you can see on the screen that you have around 7 to 8 question pattern. So from that you can realize that only mere reading of your MCQ book is not enough. You have to strengthen your concept if you want to be in the top 300, or if you want to attempt such answer at ease. Fine. So let's now go for few burning questions which students ask me. First they ask me, sir, is it enough to read MCQ book? Dear friend, whatever the MCQ available in market, like your Dental Pulse and Dentist, they are good book, but they are good book to practice MCQs, but you have to support it with the textbook reference and concept strengthening. Okay, there are 2 thoughts. One thought is master of concept and another is master of MCQ. So if you study 1000 MCQ, 10,000 MCQ, remember you will know those 10,000 points only, but if you will learn the concept, you can remember or you can solve from this concept 10,000 MCQ. Fine. And our mind is not like magic. It can remember a certain thing. You cannot remember lakhs of MCQ, but you can remember 1000 concepts. So you have to decide whether you want to be the master of MCQ or want to be the master of concept. Second is textbook reading. You don't have to read full textbook, dear aspirants. You have to refer the textbook wherever your concept is weak, wherever you think that yes, I want to read textbook or not. Okay, so textbook reference is mandatory. Then people are saying, sir, I cannot read theory, I just like to study MCQ. Dear aspirants, you don't have to read theory as you are reading in your university exam. NEET MDS, it is different exam. This exam is to test your knowledge, that how much you know in these 4 years, how much you have grasp of your subject. So theory you don't have to mug up, you have to understand it. Then dear friend, what are we going to do in our academy, or what are we going to do from now onwards? So in my Edge Revision series, we have these 3 phases of learning. First is preparation phase, which will extend from May to September. Then we have learning and revision phase, which will extend from September to December. In preparation phase, I will teach you all your 21 subjects one by one in detail. In learning phase, we will again revise in combination manner, like we will take combo of two subjects like DADH, or we have taken the combination of the cons endo or pedo endo, like that we'll have a proper combination. In revision phase, we will revise all the past papers of PGI, AIIMS, NEET, HR strip, etc. And along with that, I will teach you how to approach the papers, how to go for intelligent guessing, and etc. So we have these 3 phases of learning. Now how to do planning, dear aspirants? I always believe in my pyramid, that is, you have to read synopsis, then notes which I provide you in my academy that you have to read. After that you have to read MCQ. After reading MCQ, if you are in doubt, you have to refer your textbook, and then you have to go for revision. Revision is mandatory while you are preparing. Okay. Then what is amalgamation of preparation? That you have to divide your subjects, day and time. Subject division is my headache, dear friends. Okay, subject, whatever timetable I have provided you, you have to follow that. Day and time, how you have to divide? Every day you have to study certain amount of MCQ, certain amount of synopsis or my notes, and you have to do revision. That should be your everyday planning. Fine, you have to follow blueprint. I know nobody can follow 100% blueprint, but at least you have to follow 70 to 80%, and that decide your rank in NEET MDS. Okay, dear friends. Then comes how to complete backlog. It is obvious, when you are studying one subject, you cannot complete 100%. If you are complete, then it is well and good. If imagine that you are living around 70 to 80%, no worry. 20% backlog when you can complete. You can complete when you are revising smaller subject, like your DADH is there, oral radiology is there, journal pathology is there. At that time you can utilize those days to complete your backlog. Okay, and whenever, dear friend, you are studying second subject, don't keep the tension of first subject. Bhai, itna baki reh gaya hai, what will happen? No worry, go with the flow, go with the present. Okay. Then doubt solving is very important. So what happened when, for example, you can see question on the screen, which zone is inconspicuous during what? So dear friend, when you are seeing such question and you are not knowing, what you used to do? Majority of students, they used to upload on the Facebook, they will upload on the WhatsApp, they will ask their mentor. Dear aspirants, I am there, I will give you answer that it is early dendrogenesis. But do you think it is doubt? No, it is your unknown concept. It is that you are not knowing the concept. So whenever you will come across such question you are not knowing, so you have to decide whether it is doubt or unknown concept. Okay, if it is unknown concept, you have to go back to your textbook, you have to study wheel zone, you have to study dendrogenesis, you have to study amelogenesis. So just imagine that this type of doubt MCQs will help you to learn more and more concept. From that you can study more and more MCQ. So friends, after you study all your concept, and then only you have doubt or you have some confusion, then you can approach to your mentors. But please differentiate between the doubt and unknown concept. Keep this habit. This will be helpful to you during your revision phase, and while you're sitting on the desktop and giving the exam for 3 hours. Okay. Then one rule is the rule of 2 to 10. I always tell my students to follow. If you are learning any topic, you're feeling bored or don't want to read, at least learn 2 points or maximum 10 points. That you have to do. That is rule of 2 to 10. Then dear friends, how my schedule is there? I just put the schedule of 3 months. Remaining schedule you can check in the description box. Link is there. So see how I have divided the timetable. For example, in a May month, I keep 2 long subjects, that is operative and endo, and 1 shorter, that is radiology subject. In June, we have kept 1 long subject, that is pedo, and 2 shorter subjects. So in that manner, you can utilize your month properly and it can be easy for you to remember. So dear friends, we will have the separate image based classes. We will have separate PPM series. PPM means physiology, pharmacology and medicine. It is one of the unique way I used to teach my student these 3 subjects. For example, you are studying renal system, I will teach all the 3: physio, pharmac and medicine of renal. So that will be helpful to you when you study case based question. Okay, so every month we will go one system so you can remember. I will not make it complex. Then how my lectures will be there. So 1 online WhatsApp lectures will be there. This is very beautiful manner I have presented. This lectures, dear friend, you can access it at any time, anywhere. Imagine that my lecture is at today 8 o'clock. You cannot attend. Don't worry, just save it. You can access it anytime. Okay, and we have 2 separate groups. 1 group for lecture only and 1 group for doubt solving. So lecture group, you can keep it, you can save it. Okay, I only can message in the lecture group. So that will be useful and handy during your examination. And second, we have doubt solving group. So this we have image, high yield text, then voice notes, which explain this high yield text and image. This image will be handy for your image based question. Then we have explanatory videos. Okay. Then second format is online lecture. We have YouTube or the live lectures we will conduct. Then exam phase. So we will have the subject based exam, and as well as at the end of month we have unit test in which you can revise all the subject along with the PPMs. So dear friends, the exam will consist of 100 MCQ and NEET MDS exam consists of 240 questions. Fine, we have separate practice question also with every lecture. We have numerical based exam and image based exams also. Now dear friend, regarding fees, because of COVID-19 we have reduced our fees, plus we have also include the monthly installment. So based on that you can pay monthly and you can use the course wisely. Along with that, we have single or group subject selection. For example, we have made a 9 to 10 groups. Like for example, you are weak in anatomy, you can join only anatomy with me. So that will be helpful to cover your weaker subject. Then we have only test series, that also you can join with WhatsApp discussions. Now dear friend, mental balance. A key in success of NEET MDS is always mental balance. Find what happens, sometimes we start our day, people will tell us negative things and we will feel demotivated. We will feel very sad and our work will get disturbed. So remember 3 circles in life: inner, middle and the outer circle. In inner circle, you and your family members and best friends are there. Middle circle, your extended family members, your few relatives, your some of friends will come. And outer circle, your neighbors and those people who are telling negative thoughts are there. So your life should be affected by people of inner circle only. Imagine you are sitting here and something is happening 10-20 kilometers away. Are you going to affect it? No. So the middle and outer circle are your 10 to 15 kilometers only. So keep your mental balance. Don't hear negative people. Always focus on what you want to do. Surround your life with the inner people only. Okay? And keep on working. Fine dear friends, and any other things you want to ask, I am always there for you. All the details is there in description box. Once you can go through it. And please keep on working. And anybody want to join our course, they can also message me. Any other doubts, any monetary help also you can require, you can ask me. Till then, take care dear friends. All the best and keep on working.